Welcome to Dr. Lawrence Gayo's video channel. Today's subject is physical activity in later life and exercise in common sense.
Dr. Lawrence Gayo is a career emergency room physician for the last 50 years. Early in his practice, he noted many of the medical problems he encountered were age-related. He also noted there were significant differences in rates that people aged. This has led him to the study of exercise physiology and nutrition, which in many researches showed were important in the slowing down the aging process. This video will focus on physical activity in later life and exercise in common sense. To start with, let us study the significant physical changes that occur in the aging body.
Changes of aging start after age 30. 1. Maximum attainable heart rate declines, 1 beat per minute per year. 2. Heart peak capacity to pump blood drift down, 5% to 10%, per decade. 3. Starting middle age, blood vessels begin to stiffen, and pressure creeps up as well. 4. At midlife, one usually start to gain weight. 5. Loss of muscles, and thinning of the bones. 6. Deterioration of the nervous system over time. Decline in heart function. 1. Healthy 24-year-old heart can pump 2.5 quarts per minute. 2. Healthy 65-year-old heart can't pump over 1.5 quarts per minute. 3. Healthy 80-year-old heart can only pump about 1 quart per minute. Blood vessels changes. 1. Blood vessels begins to stiffen, loss elasticity. 2. Blood pressure creeps up. 3. Blood becomes more viscous, thickens and sticker, so it becomes harder to pump through the body. 4. The number of oxygen red blood carrying cells decline.
Weight gain with aging. There is an average of gaining 3 to 4 pounds per year after midlife. With the loss of muscle, the weight gain is more due to fat. As a result of increase in fat, rise in LDL, bad, cholesterol and fall LDL, good, cholesterol. It also causes to make blood sugar rise about 6 points per decade, making type 2 diabetes common among senior citizens.
Loss of muscle. Loss of muscle starts after 40 years of age, reducing up to 50% after the 7th decade of life, contributing to weakness and disability. There is loss of elasticity of muscles and ligaments. There is also loss of bone density, especially among women, resulting in osteoporosis. In males, drop in testosterone level. Some men might drop in blood testosterone level, about 1% per year after 40. 1. May still maintain reproductive capacity throughout life. 2. May experience gradual decline in libido and sexual vigor.
Key message: it is never just your age. Modest amounts of physical activity are good for health. Common sense, urgently needed, regarding safety. Physical activity. Movement of the body by the skeletal muscles that results in energy being expended. Physical activity that is planned, structured, and repetitively done with aim of improving or maintaining physical fitness. Old age is the age at which most of the medical profession start to lose interest in you. Old age begins and middle age ends the day your descendants outnumber your friends. Active like a hunter-gatherer. In most part of human history, man lived as a hunter-gatherer, a physically demanding life. Our exercise needs remain same as our ancestors. Technology has, however, eliminated physical work. Sedentary lifestyle is now considered normal. We have now an inactivity-induced epidemic. Physical activity, age, and physical disability. Age/motor disability. This may start with knee pain. This may be due to arthritis. This results in decrease in physical activities. This leads to muscle weakness and fatigue/poor endurance. Further restriction of activities, decreased muscle strength, and further disability. Benefits of regular physical activity. Protective against 1. Heart disease. 2. Diabetes. 3. Some cancers. 4. Mild depression. 5. Dementia and Alzheimer's disease. Deterrence to physical activity. Survey of 409 people, aged 65 to 84 years. Much of the reason they give were: I cannot. I will not. I should not. Common state of mind of this group: confusion, collective amnesia, fear. Exercise recommendations for healthy older adults. Activity of moderate intensity, 30 minutes, 5 days per week. Total of 150 minutes per week. Bouts, as short as 10 minutes. Muscle strengthening, 2 days per week. Flexibility exercises before each exercise. The more, the better. Activity and risk of heart disease. Longitudinal follow-up of 39,000 older women. Light to moderate physical activity was associated with 19% reduction in risk of heart disease. At least 60 minutes walking per week predicted lower risk. Just get out the door. In a study of 1,002 women over 65 years of age, those who were walking 8 city blocks per week were twice as likely to still be mobile than those walking less after a year follow-up. Dose-response issues concerning physical activity and health. This chart shows the result of a study that reveals the more one spend time in physical activity, the better your health. Safety of physical activity in old age. Risks of inactivity are high. Avoid sudden unaccustomed vigorous exercise at all ages. Moderate intensity, low risk. Stay within known level of comfort, start slow, build up gradually. Determinants of physical activity. 1. Encouragement and enjoyment. 2. Confidence and ability to be active and safety. 3. Low to moderate intensity. 4. Goal setting and planning. Key messages. 1. It is never just your age. 2. Modest amounts of physical activity are good for health. 3. Common sense, urgently required regarding safety. So in summary, adults aged 65 and older need at least 150 minutes a week, for example, 30 minutes a day, 5 days a week, of moderate intensity activity, such as brisk walking. Or they need 75 minutes a week of vigorous intensity activity, such as hiking, jogging, or running. At least 2 days a week of activities that strengthen muscles. Warning: if you have any underlying health problem, or problems, please be advised to consult your primary care provider before you embark on your health fitness program. Thanks for watching. Please subscribe for more videos.